organizers for this opportunity. The topic of my presentation is weekly osimertinib in lung cancer, preclinical data. As we know, lung cancer is the most common cancer and leading to the most responsible cancer for the death. Histologically, the lung cancer categorized into small cell lung cancer and non-small cell lung cancer. Furthermore, the non-small cell lung cancer categorized into lung adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Coming to the treatment with the EGFR tyrosine kinase inhibitors across the years, in 2004, EGFR mutations are discovered in non-small cell lung cancer. In 2009, gefitinib approved for EGFR positive patients. In 2019, erlotinib and afatinib comes as a first line treatment for the EGFR positive patients. And in 2015, osimertinib is approved for the T790M positive patients. In year 2020, osimertinib is approved as an adjuvant treatment for EGFR positive patients. So osimertinib, as we all know, is an oral third generation EGFR TKI inhibitor and is a standard care therapy for a patient who shows T790M, L858R, and exon 90 deletion. With this molecule, the great ADAURA clinical trial done with the resected EGFR mutated non-small cell lung cancer patients. Here, the patients were randomized into 1:1 ratio, where one group is treated with the osimertinib as an adjuvant, while other group is treated with the placebo. This trial resulted in, and it shows that the patients with who's treated with the osimertinib shows significant disease-free survival as compared to the patient treated with the placebo. So this study concludes with the daily dosing of third generation EGFR TKI osimertinib as adjuvant treatment in resected EGFR mutation positive non-small cell lung cancer patient extends the disease-free survival. And after that, osimertinib approved for as a adjuvant treatment for a patient with early stage EGFR mutated non-small cell lung cancer patients. When we gone through some literature of pharmacokinetic values with the osimertinib, we found that the distribution of osimertinib was maintained in the brain up to 21 days. That's why, so we asked the question, can a weekly dosing of osimertinib replace daily dosing? And to assess this question, we need a appropriate preclinical. And the Dutt laboratory established a preclinical model to characterize genomic alteration and novel therapeutics. So for lung cancer, we have developed two kind of orthotopic lung cancer mouse models. First is from tail vein, and other is the cell implantation through the intercostal into the not-skin mice. Also, we established a tongue cancer mouse model for head and neck cancer into the nude mice, orthotopic xenograft of cervical cancer in skid mice, and the breast cancer mouse model is currently underway in Bagsi mice. So, with this tail vein mouse model, we set to model the ADAURA trial using this model. But we have selected a non-invasive bioluminescence imaging to detect the small amount of small number of cells which home into the lung of mice, because uh, among the all imaging techniques we found uh, the bioluminescence imaging is most sensitive to detect the tumor cells among the other imaging modalities like ultrasound, CT scan, MRI scan, PET scan, SPEC. Uh, but to get to get detected in the bioluminescence imaging, first we have to tag the lung cancer cells with the luciferase gene. That's why in vitro condition we culture the luciferase plasmid with the virus plasmid, and then we generate the virus with the luciferase plasmid, and that virus particle infected to PC9, which is lung cancer cell, and when we add the luciferin with the cells, we saw the bioluminescence appear in vitro condition. Below this image shows the the actual picture of the experiment. The PC9 luciferase cells shows bioluminescence in Blackwell plate. Now coming to the tailbone mice model, it is the attractive tool to assess the homing of lung cancer cells into the lung. It is easy to perform, and cells implant into the lung of mice through the tailbone within a 24 hours, and it is easy to colony formation. So using this experimental mouse model system, we can assess the homing of lung cancer cells into the lung, which can mimic the condition used in the ADURA trial. So into the establishment of orthotopic lung cancer mouse model with by intravenous injection, we have selected the skilled mice because skilled mice has impaired innate and adaptive immunity, and also it has lack of B and T cells, and also the lack of dendritic cells as well. So to start with, this skilled mice anesthetized with the isoflurane in anesthesia chamber. After that, in aseptic condition and under the continuous isoflurane inhalation, we inject the PC9 lung cancer luciferase cells through the tail vein, which will be seeded into the lungs within a couple of hours. After that, within a couple of hours, we intraperitoneal inject the D-luciferin from the firefly, and subjected this mice to the bioluminescence imaging system. And this imaging system shows us the bioluminescence appear at the lungs of the mice, which depicts the presence of homing of the lung cancer cells into the mice. So with this model, we strategize the experiment for alternative TKI dosing. For that, we divided mice into the three groups. First group is for the vehicle control only, wherein we treated the mice with the PBS. In second group, where we provided erlotinib and osimertinib in daily dosing regimen from -3 day to 5, and bioluminescence imaging will perform up to day 18. In the third arm, where we have provided erlotinib and osimertinib in weekly dosing regimen in an interval of 7 days. The result of this study shows in the control arm, there is a continuous homing of PC9 luciferase cells, and also increasing in the luminescence up to day 18 shows the proliferation of the cells into the lungs of mice. In the daily dosing regimen, none of the mice from the erlotinib and osimertinib group shows the proliferation or homing of cells. But interestingly, in weekly dosing regimen, erlotinib treated mice fails to show fails to prevent the homing of lung cancer cells into the mice. While in osimertinib, even with the weekly dosing regimen and even with the 2 supplement post cell implantation, it shows a similar effect as compared to the daily dosing regimen of TKIs. In summary of this study, we kept these mice up to day 30, wherein we can summarize that in daily dosing regimen, the homing of cells is prevented, and also there is no tumor formation. And in weekly dosing regimen, only osimertinib treated arm shows no tumor formation. It means the osimertinib in weekly dosing regimen can achieve the similar effect as daily dosing regimen. The most importantly, in clinical setup, osimertinib costs more than 4 lakh per month. By this, by adopting this weekly osimertinib dosing, we can reduce the cost 1/7. This is the studies published in Translational Oncology in 2021. And for this acknowledgement, I would like to thank TMC ATRAC, my guide peer, for his support and guidance. Clinical collaborator, Dr. Vanita Narona and Kumar Prabhash, and all my lab members. Thank you.
Thank you, Dr. Ashwin, for your wonderful work. Any questions? I think we can have during the lunchtime also, because due to the paucity of time, we have to. Thank you, Dr. Ashwin. Excellent. May I call upon